Alright, today it's October 2008. Today we have Miss Wu with us. She had very good experience with the DRX 9000, the spinal decompression treatment. And today, I'm Dr. Lin, by the way. So today we're going to interview Miss Wu about her condition before and after this treatment. Okay, so Miss Wu, can you tell us about your pain before you had this treatment? Describe your pain, please.
I have basically between a level 0 to 10, I have a, I would say, constant 9.5 pain level. And to numb the pain, I was taking lots of painkillers, average of at least 15 Advil a day. Can't even get out of bed without taking at least 3 Advil in the morning.
Okay, can you tell us about your pain? What kind of pain you have? What this pain goes to? Is numb or tingling? Can you describe about?
I had a very sharp stabbing pain, all the way down my lower back, all the way down to my heel, left heel.
Left heel. And how long have you had this condition?
I had it for over a year. It got worse.
Okay, it got worse. Do you remember how it happened? This came on by itself, or was it some kind of accident?
It was a sports injury, and then I went to see a chiropractor and got adjusted wrong, and from then on I just got worse and worse.
Okay, so you say you're having difficulty walking activity, is that right? Can you tell us more about that?
I couldn't sit very long. I couldn't sleep very long. I couldn't stand very long. Even 5-minute drive to work was painful.
I see. So basically your life is gone.
Yeah, there's no life.
Oh, okay. So you can't do anything at all, any sports, anything you like?
Oh, no. I mean, working was just hard enough. Just to actually sit through a meeting, that was just painful enough.
So what was going through your mind when you had this kind of pain?
I was really worried that I was going to be disabled for life. So.
Okay, so what kind of treatment have you gotten before you came, having the DRX done on yourself?
I know I was taking way too many Advil, and that's not good for my body. So I started doing a lot of research online, and I actually had 2 epidural injections done. And after the injection wear off, basically I was in a lot more pain than before. So I started acupuncture. I did physical therapy.
How long did you do the acupuncture for?
I had 2 months of acupuncture, and it kind of reduced the pain level, but I know my body wasn't healing. So that's when I came across the DRX 9000 and decided to give it a try.
And you also mentioned about the injection. What about the injection? How do you feel after that?
The injection, basically, to me, it's almost like a bandage. It's a quick fix to numb the pain, but in reality, it doesn't cure my body. Doesn't heal the disc.
Does the pain come back after injection?
Oh yeah, it numbed the pain for
how long?
For a couple months.
Oh really?
And when the pain came back, it came back even more intensely.
I see. And you were also saying that you had a physical therapy done. Can you tell us more about that? What have you done on physical therapy?
At physical therapy, I had ultrasound. I had basically doing stretches. And core training and stuff like that, but I didn't see any improvement at all.
Have you done any traction before?
I did the regular traction at the physical therapy, and it just my muscle tense up when the traction was pulling me.
And how do you feel the difference between this and traction? Because a lot of people would say, no, this is just another type of traction. I mean, what do you feel?
Like I mentioned, I was having so much pain. I had to take sleeping pill every single night for over a year. in order to get some sleep. And it was DRX when I was doing my treatment. That was the only time I could actually rest. That's how comfortable it is.
So when you do the traction, you don't see any improvement, or do you see any improvement regular traction? And not DRX.
At the regular traction,
Yeah.
I didn't really see any improvement. I think partially because I also, at the time, I had my epidural injection.
Oh,
So
I see. Okay, so well, you decided to get the DRX done, and after how many sessions do you start feeling the improvement on your body?
I actually start noticing the difference after I think 3 or 4 sessions. The reason why is I measure my progress by the amount of Avil I was taking, and I was, over a course of 26 treatments, I was able to stop taking Avil altogether.
So basically, after 26 treatment, you don't have to take any drugs. Drugs
No.
stop anymore,
I
right?
stop taking any drugs.
And tell us about your life. I mean, after 26 treatment, are you feeling better? Is your life back? And
Oh yeah,
what was
my
going
energy
on?
level, recovered. Before, basically no life at all. I also I had to rest up on the weekend, just on my back, couldn't do anything. And now I have activity every single night, just going out, hanging out with friends, going out to eat, actually walking, actually started to run, and yeah.
So now when you do all these activity, walking, running, there's not much pain?
I still have some numbness, but that's why I'm still doing the DRX 9000. But I mean, I'm just definitely 95% almost there to
Okay.
full recovery.
That's great. And when you heard about the prices that were quoted to you, what was your reaction? And what was going through your mind?
Well, the price was a little on the high end at first, but if I can be pain free, I'll be willing to pay for anything.
I see. That's great. So, what would you recommend to patients?
I would highly recommend DRX 9000 because it's totally changed my life, and I'm sure other people will benefit as well.
Awesome. Okay. Thank you, Ms. Wu. You did a great job for us. Thank you.
You're welcome.
All right. Hold on a second. Make sure it's done.
I'll see my